I have something called the hollow eye syndrome, which means underneath the eye, I have darker circles. The hollowness of the eye makes me look tired, and the circles under the eyes makes me look older than my age. I'm gonna have a facelift, and it's going to take the dark circles and the hollowness away, and it will make me look the way I feel on the inside, energetic and more youthful. My name is Ildiko. I'm 34 years old. I live in Santa Monica. I have a 7-year-old son named Gage, and I'm married to Kenny. I like Santa Monica because Santa Monica is a small city, and even though it's attached to this great big Los Angeles, you still tend to feel like you're in a small community where everybody knows each other.
Ildiko and I met through a mutual friend, and it was basically love at first sight. And we've been inseparable ever since.
I decided when I got pregnant with my son that it would be a great possibility for me as a mother to be able to still be with my child at home and still make a living by dedicating my daily work with smaller children and to form a family childcare and just use my knowledge that I had. Kenny, my husband, he's a part of our daycare provider group.
What about you, buddy? Come on, okay.
He's really good with the kids. He's really good.
Uh-oh. Gotta give me a second, thank you.
It's not all fun and games, but I really like it when they're happy and they're playing well together.
Let's have reading time, okay?
Reading time.
Come on, you can park your cars. It gives us pleasure. The children are really sweet. I like what I do. Watch your steppies. I was born and raised in Transylvania, which is a state of Romania. I'm Hungarian nationality. I decided to come to United States because I always wanted to come here. And I was lucky enough to come here in 1991. I have something called the hollow eye syndrome. It's very common in Eastern European countries and in Eastern European women.
She has this tendency to get puffiness under the eyes, and she has some circles under there.
And I get comments quite often on how tired I look, even though I feel completely full of energy.
To me, it adds a lot of character to her face. It doesn't bother me at all. I know that it's been on her mind, though.
It started to bother me when, I guess, I started comparing myself to my peers and the difference between the way I looked and the way they looked. The deep setness of my eyes, I think with the combination of the circles under the eyes, it gives me a tired look. Like even if I get up in the morning early and I'm rested, the look on my face is still as if I didn't get enough sleep. And it just looks really tired, and it looks older than what my age is. So that's what I would like to have it changed. What I'm getting done on my face is an endoscopic surgery, which is supposed to be a lot less invasive than what normally people think about a reconstructive surgery. My friend Julie gave me a really good idea the other day. She suggested that maybe we should talk to a makeup artist and see if there is any chance of me learning how to cover up what I have under my eyes. Interested to look at their product.
Oh my gosh. Great, I love looking at makeup.
Quite a bit.
Ildiko, I think she's a very beautiful woman. She has beautiful characteristics.
I was wondering if you could help us out with a couple of products.
Occasionally she would say, oh, you know, I've got these bags under my eyes, but I thought, you know, I just thought, oh, you're tired, you're looking after kids, and who wouldn't be tired?
And then I'm gonna start right here. This area right here. Just Just work it around.
We met with a very nice makeup person, and she showed Ildiko ways that she could conceal the bags using certain concealers and makeup.
I also wanted to mention too that I'm going to have surgery. They will probably surgically remove the fat cells under the eye, and I was wondering, will this procedure help?
Yes, I can tell you this, I've had plastic surgery. I had my under eyes done too.
What was very interesting that she said that she indeed herself had plastic surgery, which helped her to the point where now her makeup time is cut down to literally 1 or 2 minutes in the morning. Amazing, thank you. That really encouraged me that I should go through with the surgery, and then after the surgery to go back to her and learn the tricks of keeping the youthful and delightful look. Thank you very much, Lisa. Thank you.
You're welcome.
Thank you.
Nice meeting you too.
Nice meeting you.
Okay.
Take care.
All right, bye-bye.
Tonight we're gonna have a little gathering at my house. I'm gonna have a couple of special friends over. We're gonna celebrate cooking with the old face. Very good. Now let's pop these little guys in. I love to cook, and if you take a look at my boys, you can probably tell. Do you have any worries about the surgery?
No, I'm still pretty confident about the whole thing. I should be asking you, how are you feeling? The thing that I most think about is she going to be in a lot of pain afterwards? Because I know it is surgery. I also think about the procedures involved nowadays. You could completely change a person's face, and I don't want that. I want her to look like Ildiko.
Kenny really just hopes that the person that's going to walk out of the hospital is going to be still recognizable. Hey guys, the sausages are ready.
Oh,
That's
good. Yeah.
Great big meal with my old face. I feel comfortable with myself as a person, but I think I'll feel even more comfortable. I'm going to feel better about myself. Today is the day of my consultation, and I'm going to go to see Dr. Kao. Guess this is it. Hi.
Hi, how are you?
Fine, thank you. We're here to see Dr. Kao.
Great, you can sign in for us.
Thank you. I'm really looking forward to my consultation. I think it's going to be a great source of information for us to understand how the surgery is really going to be, and looking forward to have all my questions answered too.
Hello, hi, Ildiko.
Hi, Dr. Kao. Good, thank you. How are you? Good to see you.
Hey, Kitty, how are you? I think in the preoperative consultation, it's really important for me to really talk to the patient one more time, for me to understand what is it that they want to achieve. What Ildiko has conveyed to me in the past, that she's always been unhappy with the look around her eyes. And she's complaining that her eyes make her look tired or make her look much older than she really feels, although she's only 34 years old. Ildiko's problem really is actually a very difficult problem in terms of plastic surgical correction. Traditionally, if you need to get at this region of the cheek area, it's very hard to access. Either you have to make a lower eyelid incision, or you have to make a open facelift type of incision. And these incisions are difficult for a younger patient to accept. Our surgical plan would be to perform surgery with minimally invasive technique by making small incisions here and here, and coming down with a little camera, which is called the endoscope, and working around the eyebrow area and around the bottom portion of the eye and onto the cheek area. And the effect is then to reshape the eyebrow and also the cheek eyelid junction here, so that the cheek is up and fills in that deep groove there, and then reposition the cheek. And we'll take fat from her tummy area, and then we'll place the fat in her upper eyelid region. And also we'll add some on her upper and lower lip area. I think it'll just enhance her overall look.
So there's not going to be any incision actually near the eye?
No, there's no external incision around the eyes at all. Everything is going to be done with tiny little incisions up in the hairline. And this is the advantage with the endoscope, because it really helps us limit the incision. And you'll promote less bruising and faster.
A lot less invasive than I thought it would be.
And the endoscope allows us to make small incisions that we can get into this area, and we can watch the anatomy on television, and we can do our work through the eyes of the endoscope.
I also wanted to ask you, when am I going to be able to leave the surgery center to go home after the operation?
Well, typically you'll be able to be alert and oriented fairly fast.
That's great.
Okay, do you guys have any more questions?
No, I think that's it. You pretty much answered all of them. Yeah, thank you.
Great, then I'll see you in a couple of days.
Okay.
And I think everything is going to be fine.
Thank you.
And I think everything's going to be great. Okay?
Thank you. Thank you so much.
Great.
Dr. Kao's explanation really put my mind at ease. He's, as far as I'm concerned, the best.
I don't even worry so much about the recovery part. I just worry about what the kid's going to think once they see me with all the Band-Aids on. They're going to think I'm playing
it's
dress
gonna
up.
be okay.
I hope so. He said after 4 days it should look fine. It's operation day. It's the day. I feel ready. When I decide to do something, once I'm decided, then that's it. Hello.
Hi, Ildiko. Come on in. I'm Joanna.
Hi, Joanne. Nice to meet you.
Come on this way.
I feel very good about the whole thing. I don't have any last-minute concerns. And I know she's going to look great.
Hello. Okay. Okay.
See you soon. Wait, let me have one last look.
Awesome.
Actually, I feel a little bit nervous right now, just because I know she's going into the operating room, but still feel confident.
We're just going to mark a couple of things. As you know, we're going to be elevating your eyebrows a little bit, okay? Here's what we're going to do. We're going to close your eyes for me. Open. Close. Okay. So what I'm doing now is marking out the area of the upper eyelid that looks a little deficient in fat. Open, close. I'm just marking this, your laugh line. This is so that I can know during the surgery to make sure that we get rid of this whole area. I think this is it. This is the most amazing part of this whole operation, is that she's sleeping on her own, and we're gonna be able to do that whole operation without any tube in her mouth. This is the endoscope that we're using today, and this is the cover that fits over the scope to protect the scope so it won't get dirty, so we can see through it. And these are some of the instruments made specifically for this procedure. I'm making 3 incisions right now on the right side. Actually, 2 on right side, 2 on left side, 1 in the middle. I'm gonna put the elevator in to help me lift up and elevate all the tissue that's attached to the bone. I need to free and loosen some of this tissue in order to help us create an optical cavity so that we can put the camera inside. I think this is the toughest stitch in plastic surgery right here. This is a endoscopic suture that we're gonna place. Takes a little bit of coordination. This is a tricky stitch because you have to be able to place this so it doesn't distort things. So now we've been working on her for approximately 2 hours, and we're basically done with the right side, and we're just working on the forehead right now and her brow area. We will elevate the brow.
I've been waiting 2 or 3 hours so far. Getting a little anxious, getting a little, the anticipation, and also, I'm a little worried about her. Just being on the table and whatever's going on.
Now we've dissected the entire left side, and we put these suspension sutures in, and this will be anchored up like this, so her cheek will come up like so. So what we're gonna do now is we're gonna help set the cheek up higher, and we're gonna use what is called tissue glue. It's Hemoseal. It's just additional support for the suture. And also it gave me just a little bit more vertical vector on the cheek lift. And this process usually takes about 3 minutes. Now we've completed the endoscopic portion of the operation, and we did a cheek lift to help her, the hollowness around her eye, and the brow has come up. And you can see that she has a very nice contour of her cheek. I think we have a very nice result. Right now I'm gonna go down to her abdomen and harvest some fat. We'll just add some fat in her upper and lower lips. I've infused 4 cc's of purified fat in the upper lip and 3 cc's of purified fat in the lower lips. And you can see that her upper lip, they're both very swollen and looks very exaggerated. But you have to overcorrect the lip because not all the fat is going to take. Hey, Ildiko. How are you?
Good, thank you.
Can you open your eyes for me? Open up your eyes. It's a little hard, isn't it? There you go. There you are. Everything went really well. Show me your teeth. Good girl. Smile for me. Try to smile for me. Excellent. So all the nerves are working. So it's all very good. There's Ildiko. She's a little bit groggy.
Sleeping. I want to go home.
We'll go home soon. We'll go home soon.
One slight uncomfort after the surgery was, for me, the fact that I had to sleep with a bunch of pillows behind me, basically sit up, sleep. That was hard. Oh, thank you, sweetie pie.
Got a little teddy bear on there.
Oh,
There at the bottom there.
you're so cute.
Right after her surgery, it was a little scary. I was a little concerned. It seemed like she was in some pain. Take several small sips. Drink the water.
Wasn't exactly as bad as childbirth, but pretty close to it. It's been 8 weeks since the surgery, and I'm very pleased with the results. I'll be 35 years old this year, and I didn't really want to walk around town looking like plastic surgery Barbie doll. I just wanted to look normal. So that was my intention, and I think I got it with this one, and I'm very, very happy about that. The shape of my eyes are not changed. I really don't feel like I had plastic surgery, even though I did. I just feel like something got taken out of my face that didn't belong there. Now I feel good about just pulling my hair back and having my face out there as opposed to just being shy about it. My family loves to garden. I usually buy the plants, and my husband keeps them alive. and my son is the one that usually gets himself dirty in between. Before the surgery, my husband had spoke to me and he said he's completely supportive whatever I want to do with my face, as long as he can have his wife back at the end. He didn't express any concerns of what the end result had brought, and I think he likes what he sees.
I think she looks fantastic. And when I look at the photographs from before and her face now, I can really see that, well, yeah, there is a profound change. As far as affecting our relationship, it made me look a little closer at her needs and how we see them. In a way, I guess you could say it's brought us a little closer.
And my son likes it too. Now, if somebody asks, he talks about like, yeah, Mom had surgery done, her eyes are better, the swelling is gone, and everything's fine. The water's following you.
When I look at my wife now, who do I see? I see this woman that I'm in love with, I've always been in love with. She's happier, so it makes me happier.
One of the things that we wanted to do to celebrate with my girlfriends is we wanted to go and try out a tea place.
Hi ladies, welcome to the tonic bar.
I think we'll have 3 levels. You guys want it hot or cold? I think that people feel that I'm an overall more bubblier person.
Okay. Well, I think Ildiko looks fantastic. She looks really good and it's very natural. She just seems more confident and happier with herself.
Thank you.
3 Chi doubles.
Thank you.
Enjoy.
Thank you.
You're welcome.
Exactly 4 weeks after the surgery was when I took a trip to Europe. My family is back in Europe. My parents didn't notice until I actually mentioned that I had the surgery. If I wouldn't have told my parents that I had surgery, they probably just thought America's doing me very good.
Definitely, Ildiko looks less tired. I mean, to go with her outgoing personality, to look younger, it just fits her perfectly. And I'm happy for her. How do you feel? Because I love it. I love it.
It does make me smile a lot more.
Yeah.
Kind of like come out of the shell. I mean, I was happy with myself before,
Exactly.
Yeah.
but it somehow makes you feel even better. I think I'm just a happier package this way. Like the outside reflects more what I am on the inside. So the inside is free to come more out because the outside is happier.